You are the only consumer in the world who cannot find out what you are buying before you buy it. You can price a car, a house, a plane ticket, even a restaurant meal, but not a surgery. 72% of Americans have been blindsided by a medical bill they never agreed to. And the reason hospitals won't tell you the price has nothing to do with complexity. Maria Lee, age 62, never imagined her knee replacement would become a financial turning point. She had prepared as best she could, choosing a high-deductible health plan to keep her monthly premiums manageable, accepting a $3,000 annual deductible as the cost of staying insured. But the real cost only came into focus weeks after surgery, when the bills arrived. The hospital statement listed a total charge of $28,750 for the operation. Her insurer's allowed amount was $13,500, but Maria was still responsible for the entire deductible and a 20% coinsurance, pushing her out-of-pocket exposure to over $5,100. The numbers on the page felt arbitrary, impossible to reconcile with the care she had received. Maria's experience is not rare. 72% of Americans say they would have chosen a different hospital or treatment if they had known the real price in advance, a finding from a national patient survey. But in the American healthcare system, the price is almost never revealed before the surgery. Instead, patients like Maria are left to puzzle over a stack of explanations of benefits, itemized charges, and cryptic billing codes. The hospital's charge master, the master price list, sets the starting point, but it is not the amount anyone actually expects to pay. On average, charge master prices run 3.4 times higher than what Medicare pays for the same procedure. Negotiated insurer rates are lower, but still far above government benchmarks. For self-pay patients, hospitals may offer a cash price that can undercut even the insurer's rate, but only if you know to ask, and most do not. Maria's bill included line items for the knee implant, operating room, anesthesia, and recovery room, each with its own code and price. She called the hospital's billing department hoping for clarity, but was told only that final patient responsibility depends on your insurance. No one could give her a straight answer before the procedure. It is a system designed to keep patients in the dark, and Maria's story is the rule, not the exception. Her shock and confusion are the predictable result of a pricing architecture built on secrecy, not transparency. For millions of Americans, the cost of care remains a mystery until the debt is due. Buried in every American hospital's billing system is the charge master, a sprawling spreadsheet listing thousands of services, supplies, and procedures, each paired with a price and a code. These are not the prices Medicare or insurers pay. Instead, they are starting points for negotiation, rarely reflecting the true cost of care. For decades, hospitals kept the charge master hidden, arguing that secrecy protected their business. In reality, this opacity shields a system where the numbers often defy logic. A 2019 JAMA study found that on average, hospital charge master rates are 3.4 times higher than what Medicare reimburses for the same service. For uninsured or out-of-network patients, these inflated figures become the bill. Even insured patients see these numbers on paperwork, fueling confusion and anxiety about what they might owe. Hospitals claim high list prices are needed to offset uncompensated care and to negotiate with insurers. But the complexity consistently favors the institution. Most Americans never see the real cost until after treatment. In 2021, federal rules tried to force transparency, but hospitals responded with dense, machine-readable files, thousands of cryptic codes, often buried online. Only 34.5% of hospitals fully comply, according to a 2024 audit. Many post technically compliant but practically useless data. with zeros or dashes instead of real prices. Rand Corporation's analysis shows that where transparency is weakest, commercial insurers pay the highest rates, averaging 254% of Medicare. The architecture of the chargemaster ensures that the price visible, if found at all, is almost never the price paid. Federal law now requires every American hospital to lift the veil on its prices. The Hospital Price Transparency Rule, effective January 1st, 2021, mandates that hospitals must publicly post two key items. First, a complete machine-readable list of all standard charges, including gross charges, discounted cash prices, and insurer-specific negotiated rates. Second, a consumer-friendly price list for at least 300 common shoppable services. These requirements apply to any hospital receiving Medicare funds, regardless of size or location. The Centers for Medicare and Medicaid Services, CMS, is the agency responsible for enforcing the rule. Hospitals that fail to comply face civil monetary penalties, which started at $300 per day, but after a 2022 update can reach $5,500 per day for large hospitals. For a major hospital, that is more than $2 million a year at the maximum penalty. Yet compliance remains the exception, not the rule. According to a 2024 audit by Patient Rights Advocate, only 34.5% of hospitals are fully compliant. Many post files that are technically correct but practically useless, with thousands of rows of codes, zeros, or dashes where real prices should be. The law gives every patient the right to see these numbers before care, but the gap between what is required on paper and what is delivered in reality is wide. CMS has the authority to levy fines and issue public warnings, but enforcement has been limited and slow. The next step is to examine how hospitals sidestep these requirements and why so many patients are still left in the dark. Hospitals have mastered the art of compliance without true transparency. The law says they must publish prices, but many respond with files that only look like disclosure. Some post machine-readable spreadsheets filled with zeros or dashes instead of real negotiated rates. Others bury price lists deep within their websites, hidden behind layers of navigation or locked inside scanned PDFs that cannot be searched or parsed. These tactics are not accidental. They are calculated moves to satisfy the letter of the law while keeping patients in the dark. The American Hospital Association, the industry's most powerful lobby, has fought the transparency rule at every turn, first in court, then on Capitol Hill, and now through technical workarounds. The AHA argues that publishing real prices would confuse consumers and undermine competition. In reality, the lack of usable data protects hospitals' ability to set prices far above what Medicare pays. Rand Corporation's landmark study found that when hospitals keep prices opaque, commercial insurers end up paying an average of 254% of Medicare rates. In markets where transparency is stronger, commercial prices are lower and less variable. The numbers tell the story. Only 34.5% of hospitals are fully compliant with the federal rule, according to a 2024 Patient Rights Advocate audit. The rest rely on placeholder files, incomplete data, or outdated lists. For patients, the result is a system that rewards secrecy and punishes those who try to plan ahead. The next step is to arm yourself with the right questions and demand real answers before you agree to care. Most Americans assume their insurance card guarantees the best deal, but the numbers tell a different story. A 2022 analysis in Health Affairs found that for about 1 in 7 common procedures, the hospital's cash price was actually lower than the average negotiated rate paid by insurers. This is not just a statistical blip. It is a window into a system where the list price is designed to confuse, not inform. Consider the experience of Daniel, a contractor in Texas who needed a routine hernia repair. His insurer's negotiated rate at a local hospital was $8,200, but when he called the billing office and asked for the cash price, the quote dropped to $4,600, nearly half. After a single phone call and a written request, Daniel locked in the lower rate by agreeing to pay up front. He never touched his high deductible insurance and saved thousands. These are not isolated wins. The health affairs study and patient advocacy groups confirm that cash prices can undercut insurance rates, especially for those on high deductible health plans. Hospitals set these discounts to attract self-pay patients and to ensure quick payment, but they rarely advertise them. The leverage exists, but only for those who know to ask. For patients facing surgery, the old logic that insurance always pays less no longer holds. Instead, knowing the right questions and demanding a written cash estimate can turn the system's secrecy into a bargaining chip. The tools to cut through hospital price secrecy are now in your hands. Start with Turquoise Health, Fair Health Consumer, Healthcare Blue Book, and Clear Health Costs. Each provides actual hospital prices, average out-of-pocket costs, or cash rates for thousands of procedures. On Turquoise Health, search for your hospital and the CPT code for your procedure. Download the machine-readable file and note the cash price, insurer rates, and list charge. Fair Health and Healthcare Blue Book give you local benchmarks, so you know if a quote is out of line. Before any planned surgery, call the hospital's financial counseling department, not the main scheduling desk. Ask directly, what is the facility fee, the surgeon's fee, and the anesthesia fee for my procedure? Are all providers in network for my insurance? What is the cash price if I pay up front? Insist on a written, itemized estimate for every line item. Use this language. Under the Federal Hospital Price Transparency Rule, I am requesting the cash price is posted in your machine-readable file for CPT code for my procedure. Please provide a written estimate. If the hospital refuses or gives an incomplete answer, file a complaint with CMS using the Hospital Price Transparency Complaint Portal. Reference the specific regulation 45 CFR 180 and include screenshots or file links. This process, documented by consumer advocates, has helped patients reduce bills by an average of 18%. The system is built to keep you guessing. These steps force it to answer. Opaque pricing is no accident. It is profit by design. Only 34.5% of hospitals comply with transparency laws. Chargemaster rates average 3.4 times Medicare, while cash prices can undercut insured rates. Before agreeing to surgery, demand all fees, the cash price, provider network status, and a written estimate. The system will not volunteer clarity, so you must.